You know, a blocked nose. It's gotta be one of the most common complaints out there, but honestly, it can be a real medical mystery. The thing is, the clues to solving it, they're not usually found in some fancy lab test. They're found in a conversation. Okay, so let's dive in and figure out how to become a top-notch diagnostic detective by really mastering the art of the nasal history. Look, way before you even think about an examination or a scan, the most powerful tool you have is the patient's own story. All the critical clues are hidden right there, just waiting, in their account of what's been going on. Our job is to listen, like really listen, and ask the right questions to bring all those clues out into the open. And that's the real trick, isn't it? I mean, it's not just about asking a bunch of questions, it's about asking the right ones in the right order. So that's what we're gonna do here. We're gonna build a systematic framework, a kind of clear roadmap you can follow that'll help turn a simple complaint into a really confident diagnosis. So let's kick things off with phase 1 of our investigation, the art of patient history. This is the absolute foundation for everything else, so getting this part right is, well, it's crucial. The main goal here isn't just to slap a label on a symptom, it's to really understand how that symptom, that blocked nose, that pressure, is actually messing with the patient's day-to-day life. Are they sleeping horribly? Can they not taste their food anymore? Making that connection is what gives our whole investigation meaning and, really, a direction. All right, on to our first major clue, nasal blockage. This is often the headline symptom, the main reason someone comes in. So let's break it down, piece by piece. We start with 2 big, high-level questions. First, is the blockage on one side, we call that unilateral, or is it on both sides, which is bilateral? And second, did this thing just start making it acute, or has this been dragging on for a long time, making it chronic? Just the answers to these 2 simple questions can immediately start to narrow down the possibilities in a huge way. Okay, now let's drill down a little deeper by asking 4 key questions. Number 1, timing. Is it worse in the morning, worse at night? Number 2, what makes it worse? What are those aggravating factors? You gotta think about their environment, their job, even what they do for fun. 3, how has it progressed? Is it getting worse, getting better, or just kind of staying the same? And 4, what other symptoms are tagging along for the ride? Every single answer is another piece of our puzzle. Now, this idea of progression, you really, really need to pay close attention to this. A blockage that kind of comes and goes is one thing, but a blockage that is just steadily, consistently getting worse over time, whoa, that's a significant finding. It is absolutely vital to ask about this, as it could be a clue pointing towards something much more serious, like a mass. Next up, our second major clue, nasal discharge. The nature of what's actually coming out of the nose can be incredibly revealing, but only if you know what you're looking for. So, the key question here is all about its character. Is it thin and clear like water? Is it thick and has some color to it? Or is it kind of somewhere in between? Because believe me, not all discharge is created equal. Its specific properties are a direct clue to the underlying problem. And this chart here just lays it all out perfectly. You see watery, clear discharge, start thinking allergic rhinitis. If it's what we call purulent, thick and yellow or green, you're probably looking at a bacterial infection like sinusitis. And if it's that cloudy mucopurulent mix, that points towards general inflammation of the nasal or sinus lining. Pretty cool, right? Okay, now we are moving into 2 potentially more serious clues. You can think of these as the red flags of our investigation. When a patient reports pain or bleeding, our detective senses need to be on high alert. Yeah, these are absolutely not minor details. Pain and bleeding can change the entire direction of a diagnosis. They demand really careful, specific questioning because they can indicate some pretty significant underlying issues that you just cannot afford to miss. So, the fancy medical term for a nosebleed is epistaxis, but it's not enough just to know that it happened. We need to know how much. Was it just a few drops on a tissue, or was it what we'd call profuse, significant bleeding? Quantifying that blood loss is what helps us tell the difference between a minor irritation and a potentially serious condition. Think of pain as the body's alarm system, and in the nose and sinuses, its location is basically a map that can point you directly to the source of the problem. Where it hurts tells you exactly which anatomical structure is likely in trouble. Just take a look at this pain map. It's a fantastic little guide. If the pain is right there on the bridge of the nose, it could be something like dacryocystitis, which is an issue with the tear duct. If it's between the eyes, in that ethmoid sinus region, you're probably thinking ethmoid sinusitis. And just a general feeling of pressure all over, that often points to sinusitis more broadly. See? The location is everything. Okay, we've gathered all our clues. The blockage, the discharge, the pain, the bleeding. Now for the final, and let's be honest, the most satisfying part of the investigation, putting it all together to crack the case. This is where you get to be the detective, right? You step back, you look at the whole picture. These clues don't exist in a vacuum. They form patterns, what we call symptom clusters. And recognizing these patterns is the absolute key to landing on an accurate diagnosis. And here are some classic examples of how that works. A patient comes in with watery discharge and a nose that's most blocked up in the morning. That strongly suggests allergic rhinitis. How about purulent discharge, combined with that pressure-like pain? You are definitely on the right track for sinusitis. But what about a progressive, one-sided blockage with some bleeding? Well, that's a combination that requires you to consider a much more serious cause, like a nasopharyngeal mass. So what's the big takeaway here? A great history isn't just about checking off boxes on a list. It's a dynamic investigation. It's the process that moves you from being uncertain to having real clarity, and it forms the solid foundation of a confident diagnosis. And that's what this all comes down to, really. The patient holds all the pieces of the puzzle. By asking the right questions in the right way, you can assemble them into a clear picture. The story is there. The clues have been given. The only question left is, can you solve the case?